Good afternoon, everybody. I think we are at the hour, so we will get started. My name is Melissa Devlin. I am the Assistant Director at the Grand Families and Kinship Support Network at Generations United, and we are glad you're all joining us today for our Kin Mobilization Learning Community session on dedicating kin finding responsibilities. We are here along with our co-host, Child Welfare Playbook with Marina Nitza, and we have a great lineup of presenters here today sharing their experiences on this topic. What I will do is in the chat, I will put our website. If you're not familiar with us, or even if you are, please check in on our website. We have lots of resources for you on both kin mobilization and many other topics around serving kinship and grand families. So please spend some time over there and reach out to us if there's anything that we can help you with. I'm also going to put a link in the chat for our our kin mobilization learning community toolkit that has been developed, and our strategies covered here are in that toolkit as well. So you get to see everything that we have covered and all the strategies that you can implement in your own agencies. And also, I'll put the link in there to all of our previous learning community sessions. We're still loading up the few that we had in January, but that will be done shortly, and this will be added as well. So if you missed anything, you can go back, listen to the recordings, and tap into any presentations that may have been shared. For that, we want this to be interactive, so please, this is not a webinar, it's a learning community, and so we want people to ask questions, share their experiences, good or bad, and feel free to participate in conversation on this topic. And with that, I will turn it over to Marina.
Thank you so much. Hello, everybody. So today we're going to have a panel with folks that have structured kin finding or family finding in different ways in their agencies. I know some agencies are thinking about, restructuring it or moving it, or do we centralize? Do we move more of the responsibility to our case carrying social workers? And so I thought it'd be fun to have a totally positive, this is not a debate, this is a totally positive panel, just interviewing people about what the different advantages are to the different roles, so that maybe in your jurisdiction, if you're thinking about reorganization, you could come back to this. And it could be a thought-provoking way to think about different ways to structure things. So I'd love for the panelists to introduce themselves, and I'll call on you individually, and introduce yourself, your jurisdiction, and what your role in finding and engaging kin is in your organization. So Janet, do you want to go first?
Sure. Good morning, everyone. My name is Janet Larson. I'm a social worker for San Diego County. I'm on the placement team in East Region in San Diego. And my role as a placement worker is to find placements for kiddos, solidify placements, and support the caregivers.
Right. Hader?
Hi, good morning, everyone. My name is Haider Al Faisali. I am a social worker in placement. I work along with Janet, but also I am a family finder, do the engagement part with the relatives, finding relatives, do the contact, inviting them into our meetings, and to be involved in the child's life.
Great. Jada?
Hi, everyone. My name is Jada Coleman. I am in St. Louis, Missouri. My role is actually to develop training for research kinship providers. I also do coaching and consultation with various national agencies on family search and engagement, as well as assist with the replication of the 30 Days to Family program that is evidence-based and truly focuses on helping children who recently come into foster care to be placed and also connected with their family as soon as possible. So as far as the counties that we're currently serving in the St. Louis areas, that would be St. Charles, St. Louis City, St. Louis County, Franklin, Warrenton, Lincoln, and then we do national trainings and also replications of that program.
Awesome. Allie?
I'm Allie DeTonencourt. I'm from Rhode Island. I work for DCYF. I serve the whole state of Rhode Island. So we're so small that we don't really have counties or anything like that. So I serve the whole state as far as like DCF and also the RITS, so our Rhode Island Training School as well. And it's just me and one other person. It's a two-man team. And we start with finding family from the second the case opens to the department, and it's an ongoing case, whether the child is removed or not. And then we work on it throughout the life of the case. And we even work with kids that are in the training school as they're transitioning out.
Great. Kelly.
Hi, my name is Kelly Lutz, and I supervise the statewide relative search team for the Department of Children, Youth, and Family in Washington, if I left out the Washington part. So my team completes the initial search within the first 30 days of removal, regardless of whether or not children are already with family or not. And we're responsible to continue to support the field in doing updated searches when paternity is established, if the children remain in non-relative care, if children re-enter care from failed adoptions, and even for extended foster care youth that are in care until the age of 21. So we're responsible for everybody.
Great. And Kate. We can't hear you, Kate.
Does that work?
Yes, there you go.
Okay. Good morning. I'm Kate Slavin, and I am a foster care social worker in Frederick, Maryland. I am on a team. We are the 0 to 3 or the Safe Baby team. So we focus especially on kids that come into care between the ages of 0 to 3 and help working on reaching permanency goals as quickly as possible. And my role in family finding is what is in the foster care social worker's role to do. So it all comes into play, and absolutely connecting with family, finding family, assessing is always a part of our job.
Great. Thank you guys so much. So we have a great swath of all different ways to structure family finding in an agency. So Janet and Hayder, I'm going to ask some questions of you first. So you work together in a unit. So Janet, do you always go to Hayder first, or do you do some family finding on your own, or how does that look like?
Yeah, that's a good question. So basically, our first go-to is whatever the information we get from the investigative workers. When they go out to do their initial investigations and they're speaking to everybody that's in the home, they are asking for names and phone numbers of family members. That is our first go-to, because that's somebody that the parent would already have been in touch with, someone who probably already knows what's going on. Now, when we call them, we do ask, hey, do you know of anybody else? But as far as we wait for those, my team in particular waits for the names and numbers of folks to call. You know what I mean? Before we start reaching out. We also are like, once we get a name of somebody, we check in with the caseworker who's investigating to make sure that this is somebody viable that they want us to call.
Got it. And then what does it look like when you work together with Hayder?
Yeah, it is awesome because we sit right next to each other. So that's very convenient. We can chat, we can really get into the nitty gritty, because his focus is really on digging deep in there, trying to find any single connection for this kid possible. Any family member that's available, or not even available, just any family member we can get. He's in there reaching out to every single little person, something that I don't have time to do because I'm busy just trying to find a home for the kids. His focus is more to just get in there and get the family dynamics, get that family tree down, and really find out who can be a support, who could be a possible placement, you know, all of those little ins and outs. So that's what he really spends his time. And it's wonderful to be right here because he can share with me every little thing, all the ins and outs. And so we kind of get a bigger picture of what it looks like when we're trying to call these folks to talk to them further about the placement process and what it would take for them to be approved for placement.
Got it. I think we all wish we could all sit next to the other person. That would solve a lot of challenges. Hayder, do you have, so it sounds like you have more time, which is certainly a resource. Do you have other resources for finding and engaging family that maybe Janet doesn't have access to?
I wish I can call it I have more time. I don't mind to have a little bit more time. No, but most of my time is dedicated into that super deep dive into the relative list. we have a list that we generate from our search clerk, looking into every possible kin, relative, potential placement, potential relatives. They don't know if they are related or not, and that's where my role comes. That list, and then plus we search public records to see. We get that screening information from the case carrying worker because they have that first interaction with parents. They ask always, do you have relatives? And we get that information. So what Janet does is that placement search. She look for placement to have that youth placed in a safe home, good environment. I go into that list with the mentality of like, not only placement, but I want to confirm their relationship, build their family trees, and invite them into those child family team meetings as well. Can you be a support? Can you take that youth on outings? Can you be involved in making decision? Can you support the parents if they need? Are you in support of reunification? What makes it great is that I sit next to Janet, and then we have that constant consultation with each other, talking about the case. Hey, I think I might have a good relatives. I think I might have a good connection. I'm going to share that information, and then the ultimate decision is going to be back up to the protective service worker, who's going to assess, clear that person, and then the name comes back to Janet to do more clearance, making sure that this person is checks out, safe, be around the kids, and is in support for the case.
Got it. Thank you so much for sharing that. So Kate, in Frederick, you have a lot more family finding responsibility as the case carrying social worker, possibly because you guys are a smaller, county versus a state. I mean, San Diego County is also county, but huge.
Yeah.
What roles do you take on yourself versus when do you reach out for others for help?
Yeah. So I think that we actually have recently started shifting, and we have more support, I think, and more like clear policy supporting a family finding role. But honestly, that is something that's kind of fresh and new. So it's the history of that I have on working with cases is that the foster care worker is the primary. Like, yes, we receive that initial bit of information from CPS or whatever came in with the initial reports and with the placement team. But it's so up in the air. What do you get? Sometimes a lot, sometimes very little. And then it's as you work the case, you have to figure out where you go with that. I think as a foster care social worker, initially a lot of our responses, at least for myself, is reasonable efforts. What's our policy say? Okay, we have a letter we have to send out. And so that's the part that is the policy piece that I think is changing and becoming more updated and modernized, and it's going to help us for the future. But then so much of our job is working the piece that's the clinical part, where as a foster care social worker, I'm working with the family. I have that relationship with the child. We have kids that have been in care for long amounts of time. And at that, after several years, the foster care social worker is the one stability on that case that can recognize what the needs of the case are, what the needs of that child is, and what we need to do that a policy might not offer. And then just also, so not thinking about long-term into a case, but short-term, I jokingly kind of, but also kind of not, when we first get a case, it's about building relationships. And I often will distance myself from CPS. Okay, yes, you can be mad at them. They're those guys. I'm new, I'm fresh. Building a relationship, building some trust so that the people who have the most expert on any of this is going to be the family. In the age that we are in, it's family, and the way that they have communication, it might not be a stable phone, but somehow on social media, on Facebook, on Messenger, they can sometimes find those connections that we can't in traditional ways. So I think a big part is continuing to develop those relationships we have with family, develop trust, and then also just don't stop, like keeping that on the forefront throughout a case history.
Love it. You had mentioned to me there might be some resources that the kin finder can access that you can't. Can you talk a little bit about that?
Yeah, actually, I can tell you how I actually, for the first time, implemented our Family Finder. It's a pretty, I think we've had that role in the past, but it's a new person and kind of fashioned in a more clear way for referrals and a process that was easier for me to understand. So I just did it recently on a case, and it was an incredible experience. I actually started just being like, whoa, I can't handle all the family you're finding. It was so much to process. I think it's having somebody dedicated to the role who has, I don't know all the things, actually. I'm sorry if I should know, like LexisNexis and all the search engines, but also just the time and experience of what you do. So, knowing this is what I do, this step, and then I follow up, because it's a lot of follow up. She found multiple family members, sent out multiple letters, and then got responses for a few of them, right? And then it got engagement after that response from one or two people. But that has been amazing on this case because we had no contact with the paternal side of the family. The father was deceased. And now we have a whole story that we can share with this child, whether it's currently or in the future. But it was a truly incredible experience to have that at our fingertips now.
Awesome. Thank you for sharing that story. So, Allie, you can get called in from any part of Rhode Island to lean in on a case. What kind of kin finding challenges are often brought to your team?
I would say like the hardest thing for us is those kiddos that have been in multiple placements, that have behavioral issues and age. And I think every state that I've had communications with, we all fall into that where there are these kids that are just really, really hard to make connections for. And then even as they go to our unit after they turn 18, we have like a VEC program where it's like voluntary extension of care. Like even just finding people for them that they have connected with within their time within the department can be really tricky. So it's definitely our older youth. And then the other thing is just generational trauma and generational issues with our department. And it is such a small state. So we might run searches and kind of like LexisNexis will run a TLO and we might get 50 possibilities, but 40 of them might have indications. You know what I mean? So it's just, there's a lot of that in Rhode Island too, that like depending on the family, that gets tough. So you have to tap into other resources of like maybe teachers or other people in their lives that could be appropriate.
Yeah.
So that's tough.
Yeah. What does the interaction look like as you work with a child's family or caseworkers? Like how do you all collaborate?
So again, we're small, so the collaboration's really good. Carol and I, so we have three regions that are throughout our state, and Carol and I go to we go to each of them every week, and we talk to people, and we're on the ground, and we're having those conversations and the follow-up. And seeing someone face-to-face really does change things, whether it's an email versus face-to-face. So we do that, but we do the search right as the case opens. So as it's being assigned, we're sending it out. Then we're following up on any kids that are in non-relative placement or in congregate care. And then from there, it's just constant communication. They know who to contact. People know Carol and I. They don't like, they'll just, one of us, both of us, and they'll just be like, oh, hey, remember you did this. Can you follow up with this? There's a lot of communication. We have really good communication with our caseworkers because they're seeing success and they're seeing that things are being done that they don't have the time for. So they're really relying on us and we're really relying on them because we're looking for the information, and who has better firsthand knowledge than the worker. So we communicate them with email, like phone calls, text messages, like all of that. And it's all the time. We work with CPS as well. So we'll do stuff when CPS is out at night on the weekends. And then I also work with the unit that looks for all the missing kids. So that's kind of on the fly communication. Like they can call me at any minute and say, run this license plate, run this address, run this name. So it's just really, we just have really good communication styles. And Carol and I do too, where it's just like, if something comes in, it's like, I'm working on something, can you grab it? Or like, I can take this. It's very clear where our roles are. And like, I do primarily most of the finding of the youth. So like, I might be busy with something like that. So I'll hand off something that comes in as far as a removal. So we just kind of communicate throughout the day and do check-ins.
I love that. So it sounds like you have some resources that the child's caseworker may not have. I know you've talked about TLO before, the last
Yep.
one, which it sounds like is an awesome tool.
So yeah, TLO is like LexisNexis in the way that you're getting that information. And then Carol and I, we use like you guys had said, we use our other government agency things that we have. We'll use, we have a court portal in Rhode Island, and I'll find dads all the time through like a DHS case, or we use our own riches system, and we put in, we'll put in the name of someone that comes up as a likely associate and be like, okay, there they are, and they have 2 kids, and we'll be able to gather that information from there, or try to piece it together, their family tree. Or when we're making calls, I'm not going to call someone who's been indicated 3 times for medical neglect. You know what I mean? So it's kind of like taking those 20 people, getting it to 5, and then telling the worker, like, here are 5 good ones. We're going to move on with this. So we have all social media. I use social media a lot. I use Facebook to contact parents and family members. I have an Instagram for the missing youth, and I also have a TikTok account. So TikTok and Instagram aren't like real people. I'm like some random name. But it's really helpful because sometimes I'll just get like a handle, and I'll be able to, one second, babe, I'll be able to just put that in there and then try to get friends with this person and get pictures and stuff like that. And I might see that they were at, the bus stop. Sorry, we have a sick kid in the house. So, so it's just using any kind of thing that we have in that way, and just using it to our advantage. We've found license plates before in like Snapchat videos, and from there been able to get get someone's name and address and go out and find a missing kid. It's just using what you got and just being like super resourceful.
I love it. And a plug. So Allie will be back to talk to us on March 13th about her social media strategies, which are awesome. So will Maggie, and we'll have really great guest speakers that day. So definitely come to that future.
Me and there's one other person in Rhode Island that has like more accounts than I do. More followers. I'm still not up on the followers on my pages because no one can verify who I am. So I don't get many friends, but I'm growing. And I'm hoping that the more that I grow, the more people will just like accept my friend request.
Yeah.
So
okay. Well, feel free to put your handle in here. We can all follow you. We can help with the help reinforce.
Yes.
Thank you so much for sharing.
Yeah.
So Kelly, you supervise Washington's relative search unit. So how does that team collaborate with the child's caseworker? What does that look like?
So since we touch and process so many different points in a case, like it looks a little bit different depending on the time period, but we automatically complete initial searches without request, knowing how chaotic the first 30 days after removal are. So I just access that information from our SACWA system and just keep pulling and repulling as people put placements and legal in at different timeframes. And so, like I said before, we do all of the kids, whether they've been placed with relative suitable others or foster care. And all of the kids who are in foster care or non-relative placement move to the front of the list. So I review the cases. I have 9 workers that cover the entire state. We aren't dedicated to regions. So that way we have the ability to flex and put all of our bodies where they're needed most. And so we complete them, right, like I said, without request. We send them the information of who we've located in case they find themselves in a panic and need those phone numbers right away before relatives respond to our letters. But we also are the first point of contact for relatives. So really the only people we are formally moving forward to the social worker and the supervisor are people who are interested in actively helping. So if we have the looky-loos or the people who want to just give you everybody's backstory in the family, they're not having to spend their time speaking with those folks. They're like really only getting, we share all that information with them, but the only people there's an expectation for them to firsthand connect with are the relatives that are interested in either taking placement or supporting in some sort of other way. And then of course they know that they can contact us at any point if they have somebody who's urgently losing placement today. And they've had no viable interested relatives identified in previous searches, those will immediately get assigned out for processing. And sometimes a year can make all the difference in how many relatives we find, especially if families are from out of country or out of state. It can really change from year to year. And then we also, oftentimes, because we have so many indigenous families in our state and we have so many federally recognized tribes in our state, our workers are sometimes the first point of contact in identifying a child or their family as Native. So if we identify that either in contact with the relatives or in finding enrollment paperwork and things like that with our search tools, then we're ensuring that the Native American Inquiry and ICW legal unit is getting queued in right away so that the worker is meeting the requirements and the expectations to engage the tribe.
Got it. So Washington is a big state with some regions. Do you divide the relative search unit at all that way, or are they central in whoever comes in next? Okay.
No, whoever comes in next. I mean, some offices hardly ever have removals. Some regions seem like, obviously population density impacts things, but there are definitely cycles where there's some regions of the state that are just very high in removal. And so allowing my workers to cover the entire state without being specialized or specific to a region allows us to focus wherever the need is greatest each day. And so I make assignments every morning and throughout the day each day, so that we can make sure that whoever is ready to take a case next and whichever case is most important to go next gets assigned out as soon as possible.
Yeah. Allie's wondering how you populate the cases that need to be rerun to make that list.
I'm not sure I understand the question.
So you said how you rerun lists, the kids that need it. How do you get those lists? Do those come off of your system that you have, or?
Yeah. So we have, our SACWA system is called FamLink. And so I'll run a placement report and I always go back, honestly, 8 weeks, because I don't know how everybody else's state systems work, but sometimes workers don't get placement and legal entered as timely as we might like them to, especially if kids are in juvenile rehabilitation, treatment centers, hospital settings that aren't paid placements. Those ones tend to get, unfortunately, placed sometimes late into the system. So I just run and rerun and try to make sure that I've captured 100% of everybody, regardless of whether or not they were put in on time.
Good to know, because they're creating a new system right now for Rhode Island, and they had asked us any input, and that would actually be really helpful for us to not have to sift through what we've done and just have something that can make it ourselves.
Yes. Yeah.
Thank you.
Thanks, Allie, for the question. And Kelly, so what resources does your team have that maybe a child's case carrying social worker wouldn't have for kin finding?
So, obviously time is the biggest. Our only priority is doing this. And so having been a direct line social worker and supervisor before, you're doing your best to be talking to the parents and the family that are identified through the parents or school or the kids themselves. But we have the time, tools, and resources to make sure we're finding everybody within that first 3 degrees of relationship. In Washington state, that's our definition of a relative. And so for us, depending on the family, the size of the family, that could be hundreds of people. And so we have a variety of tools that we have access to, both our in-state, like Department of Health, Child Support Enforcement, our welfare system and things like that. But then we have access to Ancestry.com, and we use Family Tree Now and a bunch of other tools. So, we have a lot of time at our disposal, and most of my team has been with me for 6 years, some as much as 10. So they're really good at their jobs. They've gotten their skill set has built over time. Our ability to learn where to not waste our time and where to focus our time has improved over time. And we also all have been social workers. So not only do we use all these tools, but we call and engage family that we identify through our search if we can't complete the search ourselves. And, you know, they're very good at engaging. And so I would say those are the primary. Yeah, and we also stagger our time that we work. So I have a team of 9, like I said. Some start as early as 6, some end as late as 6. So during that period of time, we can cover multiple time zones as we're calling people and things like that.
Love it. Thank you so much. And Jada, so you can come into a child's life. You're a super powered outside team. What do those interactions look like?
Well, we're actually initially referred a case. One of the things that we want to do is talk to those individual primary or priority contacts, meaning we want to talk to the child, we want to talk to their parents, aunts, uncles, grandparents, and then anyone the child is saying is really, or the family member is saying, you should really reach out to this person who can be a connection. When we're engaging with the child, the main thing that we try to do is engage with them and be very playful and light. So I may be out there playing basketball, throwing around a soccer ball with them. Maybe I'm having high tea, whatever it takes in order for me to just get information. Maybe it's reading a book that's talking about family and I'm engaging them in that way. So we try to find different ways to engage with kids as well. There are times where we just looked at social media accounts. It was a teenager who was telling me about their family and engaged with them that way. We also will use genograms to engage with youth. They are really engaged, as you all know, and curious about what we have found before we actually even started working on the case. We'll take the opportunity to do some searching, gather as much information as we can, and say, let me know, where am I wrong? Like, oh, and they're really good, as you know, like, no, that's not my uncle, that's my cousin. And so it's good to be humble and allow the opportunity for us to learn from them. But also when we're engaging with the relatives, we are making sure that we are getting as much information about the child as we can, because we know when a child comes into care, everything, of course, is very chaotic. So we want to find out the needs of the child, what has worked before, when they have engaged with them, how they want to be connected, who should we talk to next? We're asking all of these key questions, and then we're moving urgently. So we're not waiting to talk to people. We're engaging with them as soon as possible.
What kinds of kin finding challenges are often brought to your team?
I will say probably the main ones would be sometimes family dynamics. As you all know, there are times where family members are, someone said, just trying to find out information. So you're trying to weed out those individuals. We're very specific about what we will provide and not giving a lot of confidential information and keep the focus on the child. But then there's a lot of family members who are angry of what's going on. I'm probably maybe the first ones telling them that their child, not their child, but their niece, cousin, whoever is in care. That can be a very sensitive, delicate moment, as you all know. And it's trying to navigate those things, as well as sometimes I'm not on the phone. Sometimes if I can't contact them by phone, I'm at their door. And so I'm unannounced and people are like, wait, who are you? So it's navigating that piece too. Sometimes that can be a barrier because they're put off. Sometimes it's not. Sometimes I have to think about where I think the barrier is. And sometimes I have to kind of step aside and see, no, that was your issue. Sometimes people will let me in and do a walkthrough of their home and everything else. So you never know what people are willing to do. But we try to navigate all of those things. And sometimes there's issues with the team members themselves, the people that we're working with. We work with them on a consistent basis typically. And some of the issues that we come about is usually maybe on assessments or getting relatives or kinship providers maybe exempt from certain things and they don't agree with that. Maybe they think we're moving too fast, or so we are making sure that everything that we're doing. We're providing that information to them every step of the way. But we also have more time in order to engage with relatives. So we have a lot of information to provide. And so I initially, when I started, in that role, I did not lean into uncomfortable conversations as much, but in order to do this role, you have to, in order to figure out how you can find a solution. And so I was like, well, it's on the back of my mind. Let me just ask the question. Now, sometimes people would not tell me exactly what the solution was for them to make them feel comfortable in order to make sure that this family is connected to the child. But sometimes I had to process it and think on it. And then when they did, it allowed me the opportunity to come up with the solution, get back with my team. Hey, okay, this is the problem. What can we do? We try to be really creative and think outside the box as much as possible. So those are sometimes the main challenges and barriers, and personal biases too. Sometimes, there are team members who have some personal biases that we probably need to address, but in the most professional way, so that we can make sure that we are making sure that those connections that we have with them in the future, when we work with other youth and other family members, are adhered to as well.
Yeah. Are there resources that your team has that maybe your inside agency counterparts don't have? I'm hearing basketball skills, tea skills.
We do it all.
Yeah.
Actually, we do have a lot of resources that we tap into. Just maybe there are donors that offer resources. Sometimes thinking outside the box. I remember there was a grandmother who wanted to make sure that she was able to have her daughter or her granddaughter placed with her. And it was a licensing thing, and it was trying to figure out, well, we need to get some screens on these second floor windows. And I was like, well, that's kind of an odd one, but I knew it was needed. And so I started asking, like, hey, are there agencies, or does anyone know anybody who may be willing to have the opportunity to install these screens? And there was somebody which worked. So making that connection with the grandmother, getting them installed. So we also, when we may not have those concrete resources, there may be some people in the community that will. And so we try to make sure that we're tapping into those as much as possible. We also have the opportunity to only work in the 30 Days Family Program, just 2 cases at a time. So we do have a lot more time to do those community out of the box, knocking on your door, not expecting me visits, which really allows us the opportunity to spend a little bit more time with family members and engage with them. But we have so much also to share with the team that they would not have had the opportunity to have. And so we are tapping into those, not just that, all those people who want to be involved, we're linking them with wherever that child is going to be placed. So if it's a maternal grandmother who wants to be placed, have the child placed with them and they're placed there, then all of those paternal grandmothers, maybe paternal uncles and aunts, we're connecting that youth with that child as well. Because when we step out of that particular case and the case concludes, well, what happens with, the connection between those family members, especially if they're not like close or know each other well. So we try to have a meeting or something to connect them so that they're familiar, they're connected with one another, and they won't mind calling that paternal uncle to say, can you take them to basketball practice because I have to work? So.
Yeah, makes sense. So we have a question in the chat that I bet you have an answer to. I suspect the answer is 30 days, which is, what do you consider a realistic time frame for locating a family member? And I'll loop to the other panelists on this one if you want to think about your answers.
So yes, we are typically on a case for 30 days, not always. Sometimes based on the priorities that we have, we may just be on a case for a couple of weeks. If we're able to find those supports for the child, get them placed somewhere, and able to make sure that we have their needs identified. But when we're trying to find someone, we are trying to, as soon as we get the phone number, we're trying to call them that particular second. And if when we're talking to them, we want to schedule something with them, we're not waiting. Can you do it today? We don't want to wait till next week. And if they are, it's like, is it possible we can meet earlier than that? You know, we're always trying to also keep that urgency going so that they understand, like, a week, that's a long time for a kid. And if we can get them connected to some familiar faces, as much as soon as possible, we want to do that. So I would say as soon as possible, we're reaching out.
Yeah. Kate, do you have a time frame goal?
No, because my cases don't end until we reach permanency. And so it's an ongoing process. And I don't think it ever stops for the family. They're always like, if they're there at some point, they're going to be there. So it's different because my role is so different. But yeah, there's not really a time frame I think about it for. Of course, if we're looking for placement, very quickly in the beginning of the case is best. Yeah.
Do any of the other panelists have a real a time frame?
I can say, so for the time frame, so it's a 30 days. We have to complete a full report, searches and engage in contacting all relatives from the list that we have. However, we decided that we keep that search and the case open for the lifetime of the case. It's better to always go back and revisit in case of some of the relatives decline, change their minds later down on the road, and then also to build bigger family and more support. The more you have that engaged and involved, the better for the child.
Great. Makes sense. All right. I'd love to go around to each of you and ask if you could share one advantage of the kind of structure that you have. So Allie, I'll ask you first. What's one advantage to have a family finder like you or Carol that everyone can lean on?
I think we've all said time.
Yeah.
Time is huge and it's definitely of the essence. I think time is a huge advantage that's something that Carol and I have to look further into these families and to dig deeper. And then the same thing that everybody said, like, we're coming from a different place. We're not their direct worker anymore. Like I was a direct worker before, I was a social worker, so was Carol, CPS, stuff like that. We've been in those roles. Not having those titles opens people up a lot more. So conversations that workers are having with grandparents that aren't going anywhere might go somewhere with us because it's a different person. And we're kind of outside that, what's going on in the day to day. So that is also really helpful for us.
Yeah, great. So Janet and Hayder, how is it an advantage that you guys get to sit next to each other and work so closely together?
Well, I will say that there are so many ins and outs to family dynamics, right? And what we do is very sensitive work, right? Like we want the best for these kids. And in order to do that, we kind of have to sift through the what, right? It's like it was mentioned before, there's the looky-loos. And that's what Hyder actually has to spend a lot of his time doing, is kind of sifting through like who's just trying to get the family gossip and who is truly interested in helping the child. So to me, that is like the most beneficial team. I don't want to waste my time because when I talk to somebody, be it a relative or a foster home, right, a resource home, I sit here and I will spend a half an hour on the phone discussing these children and say, here's what's going on with the kid. Here's the behaviors. Here's the mental health issues. Here's this. Here's what this kid has been through. And this is probably why we see these behaviors. I talk through that because on paper, when you read about a kid or hear about a kid, you're like, oh, no, I can't be. Oh, that's too much. But when you stop and think about what that kid's been through, and I kind of can relay to the person, these behaviors are stemming from this, right? People really start to have empathy for the child and understand where they got to where they are. And so they're more willing to open up their hearts and their homes, right? Well, if I nothing is worse than spending a half hour, 45 minutes, really getting to the nitty gritty and discussing this kid only to have a person go, well, that's really not what I'm looking for, right? And and that's with the resource parents. And I learned to filter those things out over time. I know who are my looky-loos for the resource resource homes, right? But for the family, I might not know that ahead of time. But when I get that heads up from Hyder, like he's all, okay, this person really was pumping me for info. So I think they're just looking for the gossip, right? We really can have that connection, and we can really dig deep and start filtering our real attention towards the viable opportunities.
Yeah, love that. Jada, what's an advantage of having an outside team like yours to pull in?
It's definitely time. So we are available when family members are calling, when they're confused about the core process. Like a lot of them don't know like what is happening. They don't understand who I am. They don't understand Children's Division and how it works, how they can be a part of things. And so being also available and saying and doing what I say that I'm going to do because I have the time to do it, you know, there are times where there are family members calling me more versus calling, you know, the caseworker. And I'm always providing that information to the caseworker and explaining what that role is. But I often think like, well, if I didn't, then if they're not getting calls returned back to them, then where are they getting this information? Because we know the family members sometimes get frustrated. They don't know what to do next. And so many times it's difficult for them. And then when, unfortunately, if that child has been in care for years, then it's like, well, where was the family? And, you know, I try not to make sure that that is the case. So if people are willing and we're able to help inform them of what this whole process is, I want to make sure I am doing that as well. And just not having that connection to the people who are involved with removing their child, of course, is also helpful. But being able to build those relationships and that trust. And if I can make those connections or maybe that transition to sometimes the Children's Division in that way and relay that information, that is an advantage too.
Right. So Kate, what's the benefit of being able to do some of the kin finding yourself as the child social worker?
Yeah, I think that in my position, I think so much of what we're talking about is getting that information, right? The first step is getting the information, and you guys are right. I don't have the time, and when I get that information from you know, other resources, it's great. But then the second piece is where our role comes in, and it's very important that we do something with that information, right? So if you have a social worker who can advocate, because our policies, yes, they want us to have kin information, but then what does the policy do to support placement, contact, communication? You know, there's things that we know are important, that if there's a history of something or a charge in the past, that we're aware of that. And at times it shouldn't be a viable placement, but sometimes it is. So how do we have the social worker using their experience with the family, using their clinical skills to do something next with that information? How is it adding value to the child's life, not just a piece of paper with information in the case record? So I think, you know, being able to get that information and then being able to act on that information is the unique role that the social worker has. But I certainly see space to have the support with getting the information as well.
Yeah, thank you. And Kelly, what's the strength of having the centralized relative search unit?
I mean, I think consistency is really helpful. You know, we didn't always do our work this way. There was a time where it was the social worker's responsibility. And then specifically in one of our regions, the regional administrator was like, this isn't working. People aren't doing this. Our relative placement numbers aren't what they should be. So this unit was an experiment in a region that was successful. And so then it was extended statewide. So like all of my workers do their work the same way. We, you know, if somebody gets stuck and they're not getting help from family members or parents, then we use our knowledge within the team to have a different set of eyes to see if you can get further. I have some staff that are dual language certified, so they're able to engage with family members in their first language. So, I mean, just having the skill set within the team, but also just the consistency. And we have, you know, consistent protocols for when relatives are consistently not getting calls back from social workers when we are the ones who keep getting the phone calls over and over again, and they're coming up against a wall, or they feel like they're not being treated fairly or whatever. We have, a consistent protocol in how we deal with those situations. And I have relationships with administrators that I can bring things to their attention before it goes to constituent relations. So I think all of those things are really beneficial. And I also think that, because we have longevity in our unit, I try to always assign family cases to the same worker who had the case before. And so then when they're reaching back out to someone who maybe said previously no, and we're now at a place where we're looking at permanency and not necessarily any longer reunification, that they feel comfortable being like, now, I didn't want to deal with my sister, but if they're not going back to her, I would like to take placement. And so there's already established relationship, and they tend to be less hesitant to bring up to my workers things like criminal history or income concerns, space home concerns, because we're not the decider. We're not the social worker. There's no judgment. It's a little bit, I think, less frightening to be like, I got arrested for a DUI when I was 22. And will that keep me from having placement on my nephew? So I think that's helpful too.
Yeah, that's a great point. So my last question, and then if we have time, there's a couple of questions in the chat I will get to. But for the last question, we're going to go around. What's one piece of advice that you have for a jurisdiction that's thinking about how to improve its family finding practices? So Kelly, back to you. What's your one piece of advice?
Jeez. I think really getting buy-in from the leadership level. It is a culture shift. And sometimes, we get very protective and controlling over pieces of work that we see as our own. And so it was a hard and unpleasant shift the first couple of years that we did this, where people were like, I didn't ask for your help, stay out of my business sort of feel. And so I think really having those pre-meetings about like, this is why this is happening. We want to take this work off of direct line social workers. This is the support. Your decision-making power is not taken away, but these are the benefits of this. And like having a lot of pre-conversations instead of it happening and then having those conversations, I think will make for a more pleasant and easeful transition.
Makes sense. Thank you. Kate, how about you? What's your one piece of advice?
I would say that I think something that I've noted in the different jurisdictions I've worked in and throughout cases is how imperative fresh eyes are. And usually it happens when there's a caseworker change, because that's when I've usually gotten a case and taken a fresh look at it. But implementing something in the process or the policy that pushes that naturally into a case process would make a lot of sense to me, that it's not just something that's done in the beginning or done by one worker, but it's a continuing, ongoing process.
Great. Janet, how about you?
It is such a daunting task, right? And it is such a sensitive topic. And I would just say, always come at it with a place of empathy and having it in your heart to help the family. And when you convey that to the folks that you're reaching out to, you can get a lot further. But also I would say get creative and leave no stone unturned.
Love it. Jada?
I would suggest definitely making sure that if at all possible, family and engagement are tasks that are together. There have been times going to various agencies and they're separate. And so some person will do the family finding and then the other person does the engagement. And a lot of times with different transitions, as we know, positions change, people leave. There's a lot of information and details that can be lost within the transfer of that information. When we find a potential lead, we want to make sure that we're engaging immediately. And in order to do so, having the opportunity to do the family finding and then calling those individuals at that particular moment versus waiting for the other person to get the information and then engage with them. You may be talking about a week or so, which that's a week that that child is not connected to their loved ones. And so trying to do that as quickly as possible is the goal.
Hader, how about you? What's your advice?
Yes. So this is what I was lucky. Me and the all the other family founders in my agency were 6 total. We're new to the role, and I think whenever there is a new implementation, new policy, new um, process, it goes to the old way versus the new way. You bring in the same staff that have been doing that job for a long time. It's going to be resistance. The new staff will be fresh, a little bit of a better, new, fresh looking into the new policy, less resistance, and more aligned to the new vision of the agency. So that's one piece of advice. And never get discouraged if a family member says, no, I can't. There are people, they are just like us, have their busy schedules. Just because they're relatives, we don't expect them to be ready on a snap of, at the snap of a finger, and to take on a huge responsibility of caring for a child. So just take your time, be patient, and don't get discouraged.
Love it. And Allie.
I would say communication throughout like the agency and with it through with your worker as well, but just also very clear on responsibilities. And I know like for us, we meet with any new social worker that comes into the department from the jump and we explain our role. We don't want anyone to think we're stepping on their toes. We want them to know we have a clear job in the department and what our job is. And we're very clear about how we do it. And if you need help, how to get us. But I also just think it sets it up where they're starting to get their cases. They're not getting these emails from Carol and I being like, I have no idea what they're talking about, or why are they in my case? Right from there, they already know what our role is and why we're there and how we're there to help them. So we start with everybody like that. And I think that's really helpful from the jump.
Fabulous. Well, thank you all so much, Melissa. I think maybe we should call it there, and I will pass it back to you to close out, unless you want to try one question.
We have a few minutes for
Okay.
a question or two.
All right. Well, then if anybody on the panel that wants to answer this one, how do you learn from situations where placements with kin end up not working out? Anybody have a piece of advice there?
It's tough. I have a case where I tried really hard to make a kinship placement work, and it worked for a while and then it disrupted. And so that's hard, but I think you take what you can from the situation, which is I had time to get the kids, like to get to know the kids, their needs more. I understood the family dynamic more. And then, we have just a more experience on the case. I ended up searching for a foster family. We found a foster family and they did get adopted. But it was, well, when I interviewed the foster family that they ended up with, the lady was like, oh, are you interviewing us or are we interviewing you for the kids? I was like, oh, I'm interviewing you for these kids because I know everything about them and I know what they want from them, for them. And so, it's tricky, but that time and that process still ended up being beneficial for the case in the long run.
Anyone else have advice on that topic? Jada, I see you popped off mute.
Yeah, it makes me always thinking, it reminds me to always have a plan A, B, C, and D. And so many times what we do is make sure that, if there is a primary placement option that we are providing to the team, we also have 2 backup placement options and sometimes more. We're assessing them and doing everything that we would for that primary placement option. It takes a little bit more work to do that, but we've learned that, if we can prevent that child from going to a foster home and they can go with that uncle also who is ready and has been assessed and everything is good, let's try to do that. So I think one of the main things is just trying to have as many people who want to be involved, getting them ready for that child to actually be available if something were to happen, because life happens.
I think sometimes too, we put kids into placements and we don't know what's going on because the case just opened. And I think once that removal happens from that kinship home, we have a baseline now of that kid. We know the services that they need. We know what they require more. So we're able to talk to the people that we do call and say, like me and Carol always ask, like when they're looking for a placement, like what are the behaviors? What services do they have? Because we want to be able to let the person know, because we don't want to set them up for failure. So we're also just making sure that there is a team now. Maybe they didn't have it from the jump when they first got into care, but now we've set up that team, and we're looking for more success because the kid has all of this in place now.
Yeah.
And that takes time to get its stuff in place. It takes weeks to get them into therapy and all of that stuff. So we might have not had that, and they might have had a rough go of it with their first placement.
Yeah. Thank you. Thank you all so much. We appreciate you immensely for coming and sharing your experiences and your stories. This was fabulous. And Melissa, I will hand it to you to close out.
Agreed. Great information. Thank you all so much for coming today. Our next session is going to be on the 27th of February, and the topic is going to be raising the importance of engaging kin early. And also just check the chat. I just put in a link to our upcoming webinar that's going to be at the end of the month on licensing, the new licensing standards for kinship. So if that is something that you're interested in, please register and join us. Thanks all again. Have a great rest of the afternoon.